Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in the profession. Today we'll be seeing about failure to thrive. So before proceeding into the topic, we must know what the meaning of failure to thrive is. So when a baby is born, their birth weight has to be doubled by 5 to 6 months and the birth weight has to be tripled by 1 year. So if they have a normal growth and development only, they will have a steady improvement or the acceleration of their anthropometric measurement. That is the anthropometric measurement, which comprises of height of the child, length of the child or weight of the child, the chest circumference of this child, and the head circumference and mid-arm circumferences, everything. So when a baby gets a proper nutrition only, they will have a steady acceleration of the anthropometric measurement. So if they are having the poor nutrition pattern due to the poor feeding practices or many causes like psychological causes of the mother and many underlying disease related to the children, or the poor absorption of the nutrients in the children. So these are some of the causes which will lead to the poor absorption or poor calorie intake. So that will lead to decreased growth. That is, there will be no any acceleration of the height, weight, length or mid-arm circumference or chest arm circumferences. So in order to provide a proper nutrition, we should see that the baby receives a proper nutrition or not. So only we are telling, as per the World Health Organization, the mother has to feed the baby, that is breastfeed the baby till 2 years of age and exclusively breastfeed for at least 6 months of age. So when we do this in a proper way only, the baby's weight will be in a steady manner. So only when the baby is born, we used to tell like in 6 weeks you have to come for the immunization. So when they come for the immunization, we will check the baby's anthropometric measurement. So we will see that whether there is an improvement of the weight or length is there or not. In the same way, when a baby comes for a 5-month routine checkup, we will see that birth weight is doubled or not. So whether according to the normal, that is expected parameters of the newborn is there or not, like that we will check. If any newborn, if any children or babies, if they are lacking with the normal physiological development, that babies are considered as a failure to thrive. That is, when we are plotting the weight of the baby and length of the baby in the growth chart, there should be in between the 10th percentile and 90th percentile. So if the baby's weight and height is decreased and less than the 5th or 3rd percentile, these babies are considered as a failure to thrive babies. That means they are not having the steady gain of the weight, length and everything. So we will see one by one in detail regarding what is meant by failure to thrive. Failure to thrive definition. Failure to thrive is a term used to describe inadequate growth or the inability to maintain growth in childhood. So the attained growth will be the weight less than 3rd percentile on standard growth chart. Weight for height less than 5th percentile on standard growth chart. Weight 20% or more below ideal weight for height. So when a baby is having when we are plotting the weight and length of the babies or height of the babies, they will have less than the 3rd and 5th percentile. Those babies are considered as failure to thrive. The rate of growth for the babies are that when we consider these babies as failure to thrive is less than 20 gram per day from birth to 3 months of age, and less than 15 gram per day from 3 months to 6 months of age, and fall of previously established growth curve. That means when we are checking the preceding, that is previous month anthropometric measurement, when we compare it now, it will be decreasing. So there will be no any increase in the anthropometric measurement will be there, that is length or weight of the babies. So it will be going on decreasing manner. So why? Because maybe due to the various underlying causes, there will be no any increase in anthropometric measurement, only the decrease will be there. And next is there will be the babies has to gain about 35 gram per day for first 3 months, but whereas the babies with the failure to thrive will gain only 20 gram per day. Next we'll see the causes of failure to thrive. So first cause is inadequate calorie intake, that is maybe due to the incorrect formula preparation, neglect of the child due to the psychological condition of the mother, excessive juice consumption. Instead of giving the breast milk, if we are giving the more juice consumption, the calorie intake is very much less. Then poverty. So poverty also is one of the major cause for the children to undergo the failure to thrive. That is, they don't get the adequate food to eat. So if they are not getting adequate food, automatically there will be an inadequate calorie intake. And due to the poverty, they are having the non-availability of the food. If they have the food only, they can consume it. So due to the low socioeconomic status or less than poverty line, there is a non-availability of the food. Next is inadequate absorption. So due to the underlying disease conditions, the baby's body will have poor absorption, that is cystic fibrosis, celiac disease, vitamin deficiency and hepatic disease. That means if a baby is having the underlying disease conditions related to kidney, that is cystic fibrosis, or due to the liver poor absorption, and like celiac diseases or the vitamin deficiencies, any vitamins. So what happens, they will have the inadequate absorption. Whatever the food they are taking, it is not being absorbed properly by the body of the newborn or children. So that will cause the failure to thrive. Next is increased calorie requirement. So some of the disease condition require a increased calorie requirement, but they are not consuming that much amount of what is being required. For example, in the disease conditions like hyperthyroidism, congenital heart diseases like neoplasm, or any cancer causing diseases like then chronic immunodeficiency. So if they are very immunosuppressant patients or very immunodeficient children, they will have the increased calorie requirement, but whereas due to the various reasons like poverty or non-availability of the food, they will not consume the proper requirement what the child needs. So automatically that will lead up to a poor steady gain of the anthropometric measurement. Next is excessive loss of calories. So in certain conditions, there will be excessive loss of the calories from the bodies. Like for example, in persistent vomiting, there will be imbalance of the electrolyte balances like sodium and potassium. In that way, we have increased intracranial pressures, and increased, if they are having diarrhea also, it is one of the cause of failure to thrive. Next is clinical features. Height, weight and head circumference do not match the standard growth chart. Growth may be slowed or stopped. Physical skills such as rolling over, sitting, standing and walking gets decreased. That is, the proper milestone is not achieved and they have very lagging of their milestones. Next is mental and social skills gets decreased. Secondary sexual characteristics delayed in the adolescence. Avoidance of the eye contact. Minimal smiling, and that is due to the irritability. So they are not having the proper milestones or physical skills such as rolling over, sitting. They will not do it in the proper, that is not being established in the proper growth. Next is diagnostic evaluation. By doing the history taking, like what the nutrition they are taking, and what is the birth weight of the baby, and after 5 months how it was, and what is the APGAR score of the babies can be taken in the history collection. Next is prenatal, like intranatal, during the labor period, how was, whether it was any complicated delivery was there not, like that we can ask. Next is medical history of the child, social history and nutritional history. Next, examination test that includes Denver development screening test, complete blood count, electrolyte balances, hemoglobin level of the baby, hormone studies, like we have seen in certain cases, like the causes due to the underlying disease like hyperthyroidism or juvenile diabetes mellitus, they are having the increased calorie requirement or poor absorption like celiac diseases. If we are finding the underlying disease condition, we can cure that disease condition so that the failure to thrive, those symptoms can be reduced and they will have the good absorption of the nutrients in the body. Next is thyroid function test. Next is X-ray and urine analysis. So these all are the diagnostic evaluation in the children who are having the failure to thrive. That is, if they are not having the proper steady growth of their anthropometric measurements from weight and height. And in the same way, why we have to do the electrolyte balances, like for example in certain causes like excessive loss of calorie like persistent vomiting or diarrhea, we can check their electrolyte balance whether it is in a normal value or not, like a sodium level or potassium level, magnesium level, everything can be assessed. If they are having the electrolyte imbalances, we should correct those underlying cause, that is persistent vomiting. If we are stopping that vomiting, automatically the calories can be absorbed in the body. So based on the causes of the baby, we have to treat those causes, so that eventually it is going to treat the failure to thrive, that is eventually it is going to help in the achievement of the growth in the babies, that is height and weight. Next we will see the degree of failure to thrive. So growth parameters: for weight it is for mild 75 to 90%, moderate is 60 to 74%, and severe is less than 60%. Height is 90 to 95%, 85 to 89% is considered as moderate, and severe is less than 60%. Weight per height ratio is mild we have to consider 81 to 90%, moderate is 70 to 80%, and severe is less than 70%. So when we see this, when we are plotting the baby's height and weight in the growth chart, there will be a decrease of the curve. Then only we will identify the baby is having the mild or moderate or severe. We will categorize them. Next is management. It requires a 50% of recommended dietary allowance of calories. So each and every age group have the RDA, that is recommended dietary allowance. So based on that we have to check whether the baby is achieving those calories or not. Next is correction of any underlying disease condition. If the baby is having any underlying disease conditions like celiac diseases, juvenile diabetes mellitus or hyperthyroidism, first we have to cure those disease conditions, then automatically the baby will have a steady gain in their anthropometric measurements, that is weight and height. Next is improvement in caregiver skills. Regular and effective follow-up should be done. Improving the family relationships and living conditions, that is if they are having the low socioeconomic status and all, we can correct it. Next is eliminating the distractive events. So during the feeding times you should avoid the distracting events, because at that time if they are having the distracting events means they will not concentrate on the food. And in the same way all the underlying causes like inadequate calorie intake or excessive calorie loss or poor absorption of the calories, these all should be corrected properly. Eventually it is going to help in the improvement of the health status of the baby. Next is nursing management. We have, as a nurses, we have to concentrate on the optimum nutrition of the baby based on the recommended dietary allowance. Next is organize the program of appropriate stimulation, consistent, warm and caring environment, parental support and education. So we have to give the education regarding when to start the weaning and when till with which age we have to give the breastfeeding, and what is about the exclusive breastfeeding, what are the foods to be introduced during the weaning, and what are the do's and don'ts during the weaning. Next is discharge planning. If at all the baby's health condition is being improved by treating the underlying causes, then we have to plan for the discharge. So that's all about the failure to thrive. So far we have discussed about the what is meant by failure to thrive. So when a baby's height and weight, when it is being plotted in the growth chart, if their height and weight, that is anthropometric measurement, is going on a downward curve less than 5th and 3rd percentile, it is considered as failure to thrive. We have seen various causes, signs and symptoms and management for the failure to thrive. If you have any doubt, kindly drop down in the comment box. Kindly like it, share it and subscribe it. Thank you for watching.